Quality improvement methods in healthcare. Quality improvement is an approach to measure and improve healthcare services and their processes through systematic and continuous action. A good quality improvement program can be a balance of quality, efficiency, and profitability within a healthcare organization. There are 4 key principles that include work as systems and processes, focus on patients, focus on teamwork, and focus on analyzing the data. And I'll go into each one of these. So systems and processes, there's a need to understand the key process within the organization. Process mapping is a tool that they use, and clinical pathway steps. They help gain better understanding, and I'll go into that. So organizations need to understand key processes for quality improvement. The resources provided along with how they are utilized both affect patient care and to achieve the greatest patient outcome, and they should be addressed simultaneously. So process mapping is a tool used to better understand processes within a healthcare system. It's a visual diagram that gives results based on a sequence of events. Reviewing who and how processes were completed gives an organization an insight on how and where improvement is needed. Clinical pathway steps are gained by process mapping. This allows organizations to gain better understanding when policy and procedures aren't followed, and they determine if the changes are needed to the policy and procedures to achieve better healthcare. Focusing on patients. Organizations need to understand and they need to meet the expectations and the needs of patients along with the patient safety and the coordination of care. So organizations need to understand and meet the needs of expectations of patients. This can be done by surveying. Based from the surveys, quality improvement measures can be taken to gain better overall patient satisfaction. Patient safety, this should be placed on the top of the quality improvement plan. Workflow processes should be implemented. Staff education and training on all technology and equipment, and proper documentation by clinical staff to ensure the safety of patients. Coordination of care is essential today in healthcare. Patients are being seen by multiple physicians, and they need to have reliable, secure, and accurate medical records. It's crucial. The use of EMR systems is one of the many tools used to allow physicians to communicate with one another and care for patients more efficiently. So focus on the team. So, we all come from different backgrounds. We have different knowledge, skills, experience, perspectives. We need to work in, collaboration. This creates better creativity. We have to have staff commitment. So we have to have buy-in from everyone. That's even leaders. And improved efficiency in management and clinical processes in regards to the policy and procedures. So not one person knows everything within a healthcare system, so being able to collaborate with a team that have different skill levels, knowledge, experience, and perspectives can achieve lasting quality improvement. Staff commitment, as in buy-in, is needed for the quality improvement plan to succeed. To have an effective and functioning program, all staff members, including leadership, must be involved. Improved efficiency in management and clinical processes are needed for quality improvement. Support, communication, and resources are tools needed among staff and leadership teams. And this creates the transparency, and it's key for an effective infrastructure. So focus on the use of data. We need to measure current systems, the changes, establish that baseline, allow monitoring to ensure improvement in comparison and performance, and reduces placement on ineffective solutions. So a little bit more in detail on that, of course, measurement of current system processes and effectiveness along with any changes applied and how successful changes are. Establishing a baseline is necessary to measure performance. allowing monitoring to ensure improvement and comparison of performance over time. This is necessary for Medicare reimbursement, the pay for performance, and to continue quality care. Reduces placement of ineffective solutions because not all changes are good. So I'm going to go into some of the pros and cons. I'll do pros first here. Of course, the pros of quality improvement prevents the overuse, underuse, and misuse of services. It provides guidance in identifying what works and what doesn't work. Provider incentive programs and financial rewards, again, for the pay-for-performance. That's where healthcare is now. It increases team member efficiency and engagement. So again, working, collaborative in a collaborative group. Everybody has their minds together, and then standardization in policy and procedures. So some of the cons regarding quality improvement. Of course, it can be tedious. Incremental improvements happen. So it does take a little bit of time consuming to do this. It is an extensive investment. In the end, though, the time, then efforts that would be used in doing something that was wrong, it is saved, in the long run. But there is some investment up front. Of course, trial and error. Like I said, not everything, not all change is good. And of course, the need for buy-in from all stakeholders. So if you don't have the buy-in from all stakeholders with leadership, and down, then it's just not going to work. Any improvement plan, quality improvement. So some models used for quality improvement. There's care models. It provides highest quality disease prevention and management. There's lean models. This kind of maps the patient flow, the cost, and time effectiveness. FADE, which stands for Focus, Analyze, Develop, and Execute. Action plans, the evaluation, the measurement, and monitor a system to ensure success. Of course, Six Sigma, that one is used a lot. Define, measure, analyze, and improve control. And then they've kind of gone into a little bit more where it's define, measure, analyze, design, and verify. So now you're verifying these as well. And it measures strategy for improvement and problem reduction. So this FMEA and the HFMEA, so it's one is just failure models and effective analysis, and the other one is health failure models and effective analysis. So it's a measurement used by a multidisciplinary team that evaluates a process to prevent errors. By identifying how processes could fail, the FMEA was mandated in 2001 by the Joint Commission to minimize harm to patients. So it is one that is mandatory. And then in general, quality improvement, it's engineered around change. It provides accountability for healthcare providers, the healthcare plans, which show disparities within the delivery system. The use of care models can help develop quality improvement plans along with the use of data and process mapping. Although change may initially be time-consuming, tedious, and have trial and errors, overall it does improve patient care, outcome, staff commitment, and higher reimbursement rates. Thank you.